I'd now like to talk a little bit about the health professionals that you will be working with, particularly if you're caring for somebody at home. I think it's reassuring to know that there will be lots of health professionals to support you, and that you too shouldn't feel alone in taking too much responsibility on your shoulders for caring for people, especially as they're approaching the end of life. So perhaps the single most important person is the patient or the person you're looking after, their GP. It obviously may, in these days, not be a single person, but there will be a GP practice who is caring for that individual. And it's really important that communication between you and other carers who visit at home is continuous and updated with the GP practice. So when you're caring for somebody at home, it's really important to make sure that you have the telephone number for the GP practice, and also you know how to contact a GP service out of hours if that should be necessary, what to do in an emergency. The GP is a person who provides the sort of central point of care for a patient. They may make home visits to assess changes in the patient. They may interface with doctors or nurses who are coming out from a hospice, or the community nursing team who will keep them updated on what's happening with the person you're looking after. GPs play an essential role in obviously assessing the patient, assessing how close they are to the end of life, but other professionals may help with that, and they may be doctors or nurses coming out of a hospice to visit somebody at home, or community nurses. GPs are responsible for prescribing for patients at home and in care homes, and of course they prescribe the person's normal medication. They may decide to reduce medications as somebody's getting closer to the end of life, when, for example, cholesterol-lowering drugs no longer are as important as they were earlier in a person's life. But they're also, GPs also play an important role in prescribing medication for pain or anxiety or depression or other symptoms that the person is suffering. In addition, working with community nurses and perhaps home care teams from a local hospice, they may prescribe a just-in-case pack. These are medications for pain, for anxiety, for agitation, which are kept in the house just in case they will be needed. And then obviously a qualified health professional will administer those drugs. And increasingly we're seeing these just-in-case packs prescribed for people as they are approaching the end of life. Without any doubt, if you're caring for somebody who's approaching the end of life in their home, you will have close interaction with community nurses who may be also visiting to dress wounds. Hopefully the person won't have pressure ulcers, but to help support you manage those, and to generally keep an eye on the person. It's important that you know how to communicate and contact the community nursing team, particularly if you're anxious about the person you're looking after. I've also mentioned the hospice team. For some people who are being cared for at home, and that's increasing numbers of people who are dying from cancer who have chosen to be looked after at home, the local hospice team may be involved, and doctors and or nurses from the hospice may visit at home. And they will be particularly important in assessing the level of somebody's pain and other symptoms, and give advice both to the GP and community nurses and to you on the best way to look after the person who you're caring for. Other key players who you may come in contact with are community physiotherapists or occupational therapists, and they play a critical role in enabling somebody to live to the maximum even as they become frailer and are less able to do things. So an occupational therapist will help with deciding whether somebody may be enabled to walk using a Zimmer frame, whether they need special rails around the bath or around the toilet, or whether a commode is necessary. And also this team of health professionals who visit and care for the person in their home alongside you will also decide on other important things, like should a hospital bed be ordered and can that be delivered to home, to make it easier to care for the person but also to make them more comfortable. Similarly, a commode, similarly things like slide sheets, or possibly even a hoist and other equipment. So I'm telling you all this so that you know that you will not be alone, but there will be lots of other professionals who are also caring for the patient, who you can interact with, you can ask advice from, and who you can also alert if you are worried about the individual that you're caring for. I've talked largely about health professionals. There may be other professionals that you come in contact with, such as social workers who may come out to the home, and psychologists and pharmacists. Pharmacists rarely pay home visits, but they play a critical role in the supply of medications that the patient needs at home.
When a sore the skin is out, the other normal body-dermal cream is not going to work. You need to use the ointments. You know, when there's a wee or water, it takes them, they don't remain in the skin. So at that point, I got to learn about body-dermal spray and the cream.
I met her on the floor. And the policy said, company policy said, don't touch, don't carry. That is the company policy. The lady asked me, can you get me a towel? So I was like, what does she want to do with towel? Instead of that, why can't you ask me bowl of water? The first lady picked the towel and put it under her armpit. The other one took the second one, put it under the armpit, and they used it to lift her up and put her on the chest. I said, wow, interesting. So ever since I said, wow, I'm learning a new thing today.
When we talk about care and care job generally is all about teamwork. As a care worker, we work with a lot of healthcare professionals. Working with them is an interesting thing because you learn a lot of things, and that is what teamwork is all about. If you can't work as a team, you can't learn.